Casts are a funny thing, probably something you've never heard of. These are really only confined to the urinary system. You're not going to see these formed anywhere else. And they are basically an agglomeration of proteins all stuck together, and then anything else that's sort of circulating in that urine, in that filtrate, that gets stuck to it. And you'll see what I mean on the following slides. But just kind of a little bit of an intro here. There's a protein called the Tam-Horsfall protein, which is secreted in your nephron. This is a nephron, and there are many parts to it, but you get this protein that's secreted. And it's normally secreted, and that's fine. But if you have an excess amount of it, what will happen, it will stick together and form like a little tube of this protein. Also, this can happen when your kidneys are not filtering correctly. If the urine is sitting here and it's just collecting and not moving through, not being washed through, you will see this formation. Now, also, if you were to have red blood cells in the urine or white blood cells in the urine or something else in the urine, it will stick to this cast and form a red blood cell cast, a white blood cell cast, a tubular cell cast, those kinds of things. So they're pretty important. Not all of them mean bad things, but they do give you a clue as to what the status of the nephron and the kidney is. So kind of important. Generally, you can see these under low power. So we'll see. The first type that it's possible some of you might see is a Highland cast, and really there's not much to it. It's just pure Tam-Horsfall protein, and as I said, that's a normal excretion. So to find it, that's totally fine. They're usually cylindrical because they're forming in tubules. The edges can be sort of rounded. So this is, somewhat rounded here. 0 to 2 per field is normal. If you were to see a lot, you might want to investigate it further, but it's fine to see. A lot of times when someone's dehydrated, if they have some sort of inflammation or maybe some kidney disease, you will see Highland casts. But in a normal, healthy person to see a couple, that's totally fine. Red blood cell cast, obviously, all you're doing is you're taking that Highland cast, for the rest of these really, we're taking the Highland cast and just sticking stuff to it. So when you have a lot of red blood cells in the urine, because maybe you have some kidney damage, you have some renal issue going on, they'll stick to the Highland cast and form a red blood cell cast. Now these are pretty red. They're not going to look this red under the microscope. This has probably been enhanced a little bit. But you should be able to go, oh, that's a red cell, and there's a lot of them, and they're stuck together in this shape. That's got to be a red blood cell cast. Sometimes the red blood cells will burst, and in that case, it might stain the cast a little bit red, so that's something to look for too. That hemoglobin left behind could cause that to happen. White blood cell cast, if you have, prominent infection and you've got these casts forming, the Highland cast forming, it's not uncommon to see a white blood cell cast. Look for the granule white blood cells, the granules in the white blood cells. They're kind of hard to find, and this and the next slide are sort of hard to tell apart. So again, you don't need to be an expert, but you just need to be familiar with it here. This is generally in a UTI, you can oftentimes see white blood cell casts occurring. Renal tubular epithelial cell casts look just like the white blood cell ones. However, they don't have granules in them, and then they've got that nice nucleus that you can see. The cells are a little bit larger, I would say, than white blood cell casts. This is pretty important because, it's very significant if you find renal tubular cells, but it's very, very significant if you find them in a cast, because that means that the kidneys are really not sorting things out like they should. If you were to, say, have mercury poisoning, a lot of times that affects the kidneys pretty harshly, kills the cells all slough off and then stick to the cast and form these renal tubular epithelial cell casts. So potentially you might see that. Then we have a generic cast, which just makes life so much easier, and that is a cellular cast in quotations, because it's cells and we might not know what they are, or it might be more than one type. If you have red cells and white cells in the kidneys, you could find a red and white cell cast. A lot of times, if you saw white blood cells with bacteria, you should think, white blood cells and bacteria, those go hand in hand with a UTI, and you could correlate that to, the symptoms the patient's having, and most likely they're having some sort of urinary tract infection symptoms. Also, when you're looking at this, think about, okay, where is this coming in the kidneys? What could this mean about the nephron? Are there a lot of renal cells, the tubule cells in there? It really makes you think when you see a general cellular cast, all right, what's in here and where did it come from? So a lot of times they're pretty grainy, pretty tricky to identify, but sometimes you see them, just general cellular casts. Granular casts are in multiple stages. Usually you don't have to say, oh, it's finely granular, it's coarsely granular, but a lot of times what happens is if you form a cellular cast and let's say it sits in the tubules for a while because you have some stasis in there, you're not getting that urine filtrate moving like it should, there's some sort of issue, they'll start to degrade. And they will start by looking coarsely granular, so you can see here. And then as they degrade more, they become finely granular, which you can see here. And then when they really degrade, they become what we call waxy. And waxy can be pretty significant. We'll take a look at a waxy cast here. Generally, they're easy to identify. They have very blunt edges because they've been kind of worn down. A lot of times they have cracks in them. Sharp outlines. They could be a little bit darker than a Highland cast. A Highland cast is very clear, and a lot of times you have to kind of change the light that's going into your scope in order to see them better. Waxy casts are darker, they're a little bit denser, and so you might not have to do that quite as much as you're identifying them. Very significant if you see a waxy cast, because it really tells you that your kidneys are stopped. Those nephrons are stopped. They're not pushing the urine out. They're not filtering the urine correctly, and there's a serious issue here. So potentially some chronic renal failure may be going on. Fatty casts are kind of like the oval fat bodies. Basically, you have fat globules that stick to the cast, and you can again polarize them, put them under polarizing light, and see that Maltese cross formation. So in lipiduria, when you have diabetes, sometimes we tend to see this, diabetes mellitus. Tubular necrosis, so the cells are dying and they're not absorbing like they should. Very clinically significant. Again, something that needs to be reported out for sure. They look sort of like bubbles, again, kind of bubbly, not quite the same as the transitional epithelial, but fat bubbles essentially. Next we have some other objects that might look like casts but are not. Mucus is very common, not clinically significant, something that you will see, probably a couple people will see it, definitely. It's just a contaminant. It's, part of the normal urinary system as well. It's not a cast, so it's much longer. You can see the filaments are longer and there's more of them stuck together. You don't see as much stuck in it. This one has some things in it, but that's probably just dirt. It looks like a dirty slide to me. And then in the bottom right, you see a fiber. This could be from a baby, from a diaper. It could be from menstrual products, any of those things. And so again, don't confuse them with a cast because they're not casts. All right. So again, just wrapping up the cast idea, this is just an agglomeration, a sticking together of whatever's in the kidneys. If you're filtering through red cells when you shouldn't be, they're going to stick together potentially and form a red cell cast, white cell cast, whatever it may be. Just keep in mind that you see them really, for the most part, if you see Highland casts, it's fine. The other types are clinically significant and you do want to report those out and say, hey, let's take a look here.